Hello, everyone, and welcome to our Essential Tremor Virtual Education Forum. My name's Patrick McCartney. I'm the Executive Director of the IETF. Today, we're going to be hearing from Hilary Byatt, who is the COO of the Parkinson's Voice Project. But before we get started, I want to say thank you to our corporate partners who allow us to do these virtual webinars and our podcast series. So thank you to Cala Health, Boston Scientific, Praxis Precision Medicines, Steadyware, Incitec, Villambal, AbbVie, and Allevion Therapeutics. So I want to introduce our speaker today. Again, as I mentioned, it is Hilary Byatt. Hilary is a speech-language pathologist and the Chief Operating Officer of the Parkinson's Voice Project and has over 30 years of experience in healthcare. The Speak Out Therapy program was developed by the Parkinson's Voice Project and helps people with Parkinson's and other related tremor disorders regain and retain their speech and swallowing. So, Hilary, I'm going to stop sharing and turn my screen over to you.
Thank you so much for having me here today, Patrick. I'm excited to speak with your audience. Let me get my screen up here 1 second. Here we go. Let's see. Okay, are you seeing that okay? Perfect. Well, let's get to it. We're going to advance. Here's some more information as a reference. And let's start talking about essential tremor. Thank you. We're good. Thanks so much, Jamie. Okay, thank you. I wanted to start by saying I am not an expert on essential tremor. I am an expert on Parkinson's and speak out therapy. But I bring a very important message that I think is very helpful to people with essential tremor, and I'll get to that as we go through. We have here at Parkinson Voice Project treated patients with essential tremor, so I know some of them have gone through our program and benefited. So for that reason, I want people out there with ET to know about Speak Out Therapy, because if it can help, I want to help them. So let's start off in the beginning talking about essential tremor. These are facts your audience probably is well aware of, but I'm going to share it and compare it to Parkinson's for our discussion. So unfortunately, essential tremor is very common. Up to 10 million Americans have it. Parkinson's, by comparison, only I say now, only about 1 million people in America have it. Essential tremor is characterized by continuous, measured trembling in one or more parts of the bodies. And as we'll explain, Parkinson's, if there's a tremor, it's a part of other symptoms. And the curious part is that tremors are usually absent at rest. Let's look more at a comparison. When you look at Parkinson's compared to essential tremor, the tremors. So for Parkinson's, tremors are usually present at rest. And as soon as the person starts doing an action, whether that's eating, walking, moving, brushing teeth, putting on a seat belt, the tremor subsides. Compared to essential tremor, where it's actually the opposite. Tremors are seen mostly during action. And I understand how annoying that can be, because you're doing something and all of a sudden you start having a tremor. So you're eating and all of a sudden it starts in the middle. You're not expecting it. It interrupts the action. Parkinson's has 4 cardinal symptoms when people are diagnosed. Typically, those include slower movements, a stiffness, rigidity, postural instability, which means stooped posture at times, walking becomes challenging at times, and then finally the tremors. And for Parkinson's, the tremor is often what sends that person to the neurologist for a diagnosis. The other symptoms are either ignored or monitored. But when that tremor occurs for most folks, it's hard to ignore. That's when they're seeing a neurologist. In essential tremor, the tremor is the primary symptom. And then finally, in Parkinson's, hands are affected more than the legs. The voice and the head are not usually affected with the tremoring. Now, in essential tremor, it says that, as I have learned, hands are predominantly affected. But the tremor is also present in the head and the voice, but rarely in the legs. Let's talk about speech as related to essential tremor. The symptoms of a problem with speech and essential tremor include, and some of these cross over from Parkinson's. The first one is shaky, breathy, or a hoarse voice. Next, a pitch break, so inconsistent variations in the pitch, often as a surprise, not expecting it to happen. A softer voice, that is one of the hallmarks of Parkinson's. And problems modulating intonation and pitch, up and down, hard to control that. And why is this happening, you might want to know? Well, it's happening because speech is complicated. Speech involves 3 different systems working harmoniously without conscious effort. Speech starts by respiration, so diaphragm, breathing in. Next is phonation, meaning the air comes through and hits the vocal folds, and that's where sound is produced. Finally, the air travels out and it's articulated. So we use our articulators for that. So think your tongue, lips, teeth, jaw, and palate are forming the air in the way that sound is produced. So any interruption, I will say, in any part of these systems can cause a problem with speech. So if there's spasms that happen involuntarily to any part of this, they can disrupt the overall balance and the smoothness of speech. So as a result, the voice can feel unreliable, difficult to control. And in Parkinson's, I mentioned there is a softer voice. People often with Parkinson's aren't aware that their voice is getting softer. They have something called a sensory deficit, and it means their internal feedback loop is compromised. They're not able to fully hear how they actually sound. So they are not convinced sometimes that their speech has changed. That can be a really frustrating part. So I want to talk more now about speak out therapy. So speak out therapy was developed by us here at Parkinson Voice Project. And it helps people with Parkinson's and related disorders regain and retain their speech and swallowing. And the part of it that I want to focus in on is intent. We focus on intent. And intent helps people with Parkinson's bypass their problems and compensate. How does that work? Well, we as humans are wonderfully made. In our brain, we have 2 motor systems. We like to call these the automatic motor system and the intentional motor system. So if you look at the slide on the left-hand side and you see those green lines, this is showing how nerve messages pass from the top of the head, the brain, down. And on the automatic motor system, what happens is you have an impulse and you want to do something. Well, how that message moves is indicated here with the green lines. The green lines are kind of like a country road. And what happens is the message moves a little bit, it turns, it stops, it moves, it turns, like if you're going through a country road in a small town. You stop at the stop signs and you turn. This is how the messages move on the automatic motor system. This motor system is highly dependent upon dopamine. When people with Parkinson's go to the neurologist and are finally diagnosed, usually because of that tremor, they have lost between 60 and 80% of their dopamine. You might say, okay, what does that matter? Well, dopamine is that neurotransmitter, and it is responsible for the planning and execution of automatic movements. Things you don't even think about doing: walking, talking, managing your own saliva, putting on a seat belt, eating. All these things happen automatically. And with Parkinson's, they are what is mainly affected because of that lack of dopamine. But there is good news for those folks. We talk about now the intentional motor system. So same brain, but this is how we can use it differently. If you look at those blue lines that come straight down, the nerve messages, impulses travel straight down like you're on a highway. It's 2 a.m, there's no one else on the road, you don't have to stop. That's how the messages go. This system is not so dependent upon dopamine. So this is how people with Parkinson's can compensate by not having adequate dopamine and learn how to use intent. The intentional motor system means that you do things on purpose. So for speech, it's thinking about what you're going to say and saying it with intent. That's the basis of speak out therapy. Let me show you a video of a patient who has gone through Speak Out.
Tell me your full name.
Hilary Byatt.
Hang on 1 second. I want to make sure the sound is coming through. I apologize for this interruption. Patrick, I want to make sure that you're hearing.
I could hear the video.
Voice treatment. Do you notice a change in your voice or speech?
I don't choke eating a hamburger from time to time.
Make sure I'm doing my exercises as nearly daily as possible. It may be only 5 days a week, but I do it as nearly daily as possible. And that is extremely important.
My full name is George Holloway Candler.
Tell me how you maintain the strength of your voice. What's your routine?
Physical exercise and voice exercise are essential because people for many years have gone, "What, you have Parkinson's?" And I can say, yes, I do. But it is crucial that you do this regularly. And I know if I don't, if I slide, I start choking. My standard has been a certain burger or biscuit that I have. And when I start to choke on that, I know, whoops, got to get back in and do this thoroughly.
So you can start to see a difference pretty quickly if you stop for how many days?
3 days.
Again, how long?
3 days.
3 days. So if you don't do your speak out exercises for 3 days, you can start to tell it.
I then need to watch out for the biscuit. I can speak, you can hear me, and this is why.
Tell me.
So George is a great example of how speak out therapy helped him regain and retain his speech and swallowing. Just a mention about swallowing. People with Parkinson's are at higher risk of having a swallowing problem. The muscles used for speech are the same one used for swallowing. So that is why it's really important they go through speak out therapy to maintain and put off prevent a change in their swallowing as well. So the benefits of intent is that with intent, people learn to use more effort to speak. That is a concept that can benefit people with essential tremor. Learning how to say things like you mean it in a focused way. It's paying attention. You know, everyone's had examples of speaking with intent. You can think back to a job interview or a presentation you might have given or a difficult conversation you may have thought about and planned for. It's just thinking about how you're going to say something. You're saying it on purpose. That's the idea of intent. In Speak Out Therapy, we also teach the care partner. The care partner is an essential part of the program because we're asking people to change how they speak for the rest of their life. That requires some assistance. And we teach people in therapy, and then that carryover happens at home. So the care partner learns what the best cue is for the patient to speak with intent. That's an important part of how we teach. The results then of Speak Out Therapy are improved volume, the voice gets stronger, stable voice that's more consistent, clearer speech, the articulation sounds like it should. And then this one, I think, which is most important, is increased confidence. I know from the research I have read about essential tremor, it is very disconcerting to be able to speak and then not be able to rely on your voice. So I can see how that can rob someone of their confidence in speaking. And Speak Out Therapy is a way that could help with that. I want to walk you through the components of our program now. This is our circle of intent. It's a circle because we want it to be very clear that we are with our patients for the long haul. Parkinson's is a neurodegenerative disease and it could progress. And so we want patients to know that we will be with them forever. And the Speak Out Therapy program starts, if you look at the top there, number one is a Speak Out evaluation. You would have a certified Speak Out provider. So that is a speech language pathologist who has gone through our certification course. That is a 10.5-hour course that teaches them all of the components of the program. We also have excellent examples, recordings of individual sessions. We have group sessions. We have research. It is a very interactive, very comprehensive program. They are well trained. And then we provide ongoing updates very often. So you would have a Speak Out provider do an evaluation. In that evaluation, it would be an assessment of the person's speaking ability and to find out immediately if they are stimulable for Speak Out Therapy. We can instruct on how to speak with intent and have the patient speak with intent. And if they can do it right away, which most people can, their voice clears up, it's not hoarse, it's at the appropriate volume, it's clear, then we know they're an excellent candidate. From there, step 2 is we give all of our patients access to our digital e-library. This is a helpful part of keeping therapy interesting, entertaining, and dare I say fun. We have a wealth of resources, and it's really important that they are simple and effective. The third step is watching the What is Parkinson's video. We have this available on our website. It's a great overview by our founder and CEO, Samantha Ellen Derry. She walks people through Parkinson's, how it presents in speech and swallowing, and how intent is the answer for those areas and more. And then step 4 is individual Speak Out Therapy begins. That is with the certified speak out provider. We are typically treating patients twice a week for 4 weeks. We pause for 4 weeks and then come back for a final session. That pause time is to make sure the progress made is at graduation is maintained during those 4 weeks. Also ensuring the daily practice is working and ensuring their speak out therapy group works for them still. So once they have graduated from individual, as I mentioned, they are then transitioned to a speak out therapy group. That group meets once a week for 30 minutes and is with other speak out graduates. The purpose is to practice speaking with intent at the conversation level with other speak out graduates. It's led by a certified speak out provider. There is a mini speak out warm up, and then the focus is speaking with intent. Our patients say this is often the highlight of their week. There is a wonderful camaraderie with a shared experience from others going through speak out who also have Parkinson's or related disorders. It's encouraging because you're motivated by your peers. And I've heard many say it helps hold them accountable because they know they're going to have to speak with intent and they will be encouraged to do so. So that group happens forever, weekly. Then you have a refresher. These are scheduled as clinically appropriate between 3 and 6 months after discharge from individual therapy. And those are just, a checkup like you have with your cardiologist or your dentist. The certified speak out provider is making sure your progress again is maintaining, that you're practicing every day, and that group is a good fit for you. And then if more sessions are indicated, we can just schedule more sessions. Here at our clinic in Texas, Parkinson Voice Project as a nonprofit does not charge for any of our services. We are funded since 2008 by grateful patients, their families, and generous donors from all over the world. And so we have the ability of doing whatever is clinically appropriate without the worry of insurance. We also have 28 speak out therapy and research centers across the country. We have the vision that everyone in America will have the opportunity to have speak out therapy without charge. Our centers are located in university clinics. Our vision is to have one in every state so that from there, research is done on speak out and patients are treated in that state. These centers are not charging for their speak out therapy either. They have the opportunity of treating patients as we do here through telehealth. And also, I just want to mention, we have trained thousands of other speech-language pathologists all over the world. So they are doing speak out therapy in those settings in which they work too. So it is not only available here and at the center, in the centers, it's all over the world. Okay, back to our circle of intent. The number 7 I want to draw your attention to is the daily speak out home practice. This is an essential part of speak out therapy. I wish that I could just throw magic dust and tell someone how to speak with intent, and they always would. But unfortunately, or fortunately, how you look at it, Parkinson's is a movement disorder, and it responds really well to movement. That's why exercise is so important. The speak out therapy exercises are just that. They're exercises that keep these muscles strong. There are 6 exercises that patients do every day. We have the engaging e-library that patients can practice from, but we also have an online speak out home practice session that is live Monday through Friday, and then it's recorded. It is a quick 20-minute exercise that patients can hop on online, get their exercises in, be reminded to speak with intent, and get on with their day. We know folks are busy and they have lots of other things they have to do, but maintaining their voice has to be a part of it. Our goal is to keep it engaging, interesting, and fun. I want to show you now a little more about Parkinson Voice Project in our clinic here in Texas.
There's so much incredible work done by nonprofit organizations right on our doorstep. Let's take a look.
Approximately 10 million people worldwide are living with Parkinson's disease. 90% are at risk of losing the ability to speak and swallow. This is a major concern for patients and their families. Since Parkinson's is progressive in nature, many people mistakenly believe that speech therapy won't help. But today, you are going to see that nothing could be further from the truth, thanks to a nonprofit that has developed a unique and highly effective speech treatment for Parkinson's.
Parkinson's affects the speech and swallowing of most people with Parkinson's. The symptoms that they notice can be different. Some people notice a hoarse sounding voice. Some people notice that their volume has gotten significantly softer, so they're having to constantly repeat themselves. There is an estimated 10 million people living with Parkinson's in the world. 90% of them will struggle with speech and swallowing.
Parkinson Voice Project's Speak Out Therapy program is unlike any other Parkinson's treatment.
Parkinson Voice Project's mission is to help people with Parkinson's regain and retain their speech and their swallowing. It is very important that people with Parkinson's and their families understand the difference between the automatic motor system and the intentional motor system. The automatic system is responsible for anything we do without conscious effort. Talking, swallowing, walking, getting out of a chair. Those are all examples of automatic movements. But automatic movements are highly dependent on dopamine. And people with Parkinson's, by the time they have any symptoms of the disease, they've already lost about 60 to 80% of their dopamine producing cells. So their automatic motor system does not work very well. But humans have a backup system, the intentional motor system, which is not as dependent on dopamine. And that's why when people with Parkinson's speak with intent, when they swallow with intent, when they concentrate, when they focus, when they're deliberate, their speech and their swallowing improves. Parkinson Voice Project is the only nonprofit organization in the world solely dedicated to helping people with Parkinson's regain and retain their speech and their swallowing.
Parkinson Voice Project is replicating its program across the U.S. and abroad as quickly as it can.
At Parkinson Voice Project's headquarters, we treat patients who live in Texas, but we want people with Parkinson's everywhere to have access to our Speak Out Therapy program. So we are training speech-language pathologists and graduate students all over the world. We want everyone to have access to the treatment.
The difference in a patient's speech with Speak Out Therapy is truly incredible.
George Holloway Candler.
I'm George Candler, Parkinson Voice Project. It has been amazing. It has been wonderful. My voice volume is fine. My voice control is good. My speed's not quite as good. But compared to what it was 17 years ago, I sounded like a tape on slow motion. And now my speed is pretty good.
1, 2, 3, 4, 5, 6, 7, 8, 9,
10, 11, 12, 13, 14, 15.
Before I had the therapy for Parkinson's voice, I did not realize I had a problem. And after my first session, I realized, oh boy, I sure do. The difference Parkinson Voice Project has made in my life is beyond measure. Not only helped me get my voice back, it brought me together with people that are amazing and inspirational, and they've given me a purpose.
We can help you with your speech and your swallowing. We know exactly how to treat these disorders, and I hope that everybody with Parkinson's will call us and visit the website so they can find a provider near them.
To learn more about Parkinson Voice Project, visit their website at parkinsonvoiceproject.org or view this segment again on thebalancingact.com.
So I hope that gave you some more information about Parkinson Voice Project. I encourage you to visit our website. It is a wealth of knowledge. And if you're curious about Parkinson's, it's a great way to answer some questions. We have a blog that has interesting information. And then if you're interested in trying speak out therapy, there is the Find a Provider link on the website. If you're in Texas, just call us here at the clinic. The number's on the website. And if you're anywhere else in the country, you can start the Find a Speak Out Provider search. And if you're in a state that has a Speak Out Therapy and Research Center, you could start there, and your services there would be without charge. Otherwise, there are other speech language pathologists who are trained, and they're listed there as well. I encourage you to give it a try.
Hilary, thank you very much. I appreciate you taking the time today and speak with us today about the Parkinson's Voice Project and sharing all that great information. We hope everyone finds that very interesting, especially if they're having challenges with their voices. So if you have any questions regarding essential tremor, we encourage you to visit the IETF website at essentialtremor.org, or you can call us toll free at 888-387-3667. And finally, if you're a donor to the IETF, we thank you for your support. And if you aren't currently a donor, we hope you consider making a gift to help us continue the work we do, promoting ET awareness, education, support, and research. So finally, we host a variety of these ET education events, so look for notices about these events on our Tremogram e-newsletter, our social media, and our Tremor Talk magazine. So Hilary, thank you again for joining us today, and we hope you have a great day.
Thank you so much, Patrick.